Welcome to Newsmax Health. I'm Kathleen Walter. With us today is a very special guest, the CEO of the American Cancer Society, Dr. John Seffrin. And Dr. Seffrin, thanks so much for being with us today.
Oh, you're very welcome. I'm looking forward to it.
Well, your very first encounter with cancer came when you were just 10 years old. You lost your grandmother. You also lost your mother to cancer, and your wife, Carol, I understand, is a breast cancer survivor. Over the years, what has been the biggest step forward that we have made in dealing with cancer?
Well, without any question, I think our biggest step forward is changing cancer into a survivable disease. We're 100 years old this year, and when our organization got started, any significant diagnosis of cancer was a virtual death sentence. And really, we didn't know much about what to do. Now, 2 out of 3 people in America survive the disease long term, and we have the evidence and information of what it will take to make that 3 out of 3. So the cancers in my grandmother were terrible because we turned our living room into a hospice room, really, and she suffered terribly. My mother also died, but she didn't suffer. And my wife had breast cancer, but she'll never die of that breast cancer because it's been successfully treated. So the bottom line is that we can now begin to talk about finishing the fight, to actually bring cancer under control as a major public health problem, first in the United States and then hopefully around the world.
Doctor, what are the most promising areas of research that we've made in recent years, and what is the next big breakthrough?
Well, I think there will be no question but what the next big breakthrough will be additional new curative targeted therapies. And the American Cancer Society, along with the federal government, is funding a lot of that kind of research. And just think about it. We funded Brian Drucker, his first year out of medical school in 1985, $55,000. Fast forward 15 years and we have Gleevec, the first targeted curative therapy in some of the patients with chronic myelogenous leukemia. Now we have several of those, and if we continue to invest in cancer research, we'll get more and more. So I think that's the big breakthrough. But I think a couple of other things are important. If we're to solve the cancer problem, though, we have to also prevent the preventable. And most human cancer we now know how to prevent during a normal human lifespan. So that's a huge, the best of all is never having cancer in the first place. And then the final thing, of course, is that we have to provide quality health care to everyone who needs it. That's such an important thing. Most of the people who die today, 1,500 people today will die of cancer in America, and most of them are needless because they didn't have access to quality health care.
Now, most people diagnosed with cancer are age 55 and older. What are the most important things a person approaching that age can do to prevent cancer?
Well, I think lifestyle is important throughout life. But I think the most important thing when you get to that age is to make sure you have access to quality health care and get the kinds of checkups that you need. So, for example, colon cancer. Only about 50% of Americans age 50 and above get regular colorectal cancer screening, and yet we've proven that use of that can prevent cancer in many patients and find it at a curable stage in others. So I think a key point for people 50 and over is to recognize that they've got to have access to health care. If you catch that colon cancer early, you can be cured. If you catch it late, it's a whole different scenario.
Now, the American Cancer Society is a huge organization with more than 3 million volunteers and $1 billion plus in resources. What is the best way, in your view, to focus these resources? Research, screening?
Well, we think, well, you know, it's interesting. We're going through a major transformation. We're changing our platform. And the reason we're doing that is I met with our board and I said, look, here are the data. We're saving 400 more lives from cancer every day than we were in 1991 when the cancer death rates started to go down. But guess what? Here's the data. It could be 1,000 a day, but we need to change our platform. And they said if we can save 1,000 more lives a day, then we'll change the platform. So we're changing the organization. We have to do 3 things to solve the cancer problem. One, we have to redouble our efforts in cancer research. It's a serious problem right now with the whole issue with the budget today and sequestration. It's such an objectionable thing. I was having a hard time finding the word. But we have to redouble research for cancer, and we need to promote prevention into public policy everywhere, and we need to provide access to quality health care, including palliation, which means you treat a patient, the whole patient, not just the disease, to make sure that they don't suffer any more than need.
Now, cancer is second to heart disease as the biggest killer here in the U.S. I think 580,000 will die this year alone from cancer. Do you think things will change significantly, or will cancer be a major killer for generations to come?
That's up to us. It will be I think, inevitably the #1 cause of death in the world if we don't take action. If we take action, we can talk about it being the first major non-communicable disease brought under control in the 21st century. It's an exciting time. I've never been more excited about the possibilities because we have the evidence. When I got started 40 years ago as a volunteer, we had lots of aspirations and hopes and prayers, but we didn't have much evidence. Now we've got a lot of evidence. So the answer to that question rests with us. Are we going to make cancer a major commitment? If we do, I guarantee you we can save more and more lives, and the death rates will continue to go down as they have for 15 years in a row, year over year over year. If we don't, then clearly, because it's an aging population, we'll see more and more cancer, and it'll become a much heavier burden, both in terms of public health and on the economy.
Doctor, earlier you talked about access to care. How will Obamacare change or impact survival rates and quality of care for cancer patients?
It should change it dramatically, starting actually this year. It's interesting because, of course, Obamacare is controversial to say the least. But when people learn what's in it, not Obamacare, or we say the Affordable Care Act because that's the legal name of it, and we're for affordable care. Bill's not perfect, of course, but if you think about a cancer patient, think about my family or your family. My wife got cancer, she couldn't get any insurance anymore. So if she couldn't be on my insurance, she couldn't get insurance before. No longer can you deny someone insurance because of a pre-existing condition. So just those two things change the world for a cancer patient. That's the big piece of Obamacare that will save this nation, not only public health, but the economy, is the emphasis on prevention. And we've got to keep people well longer, or we've got some real problems. As was said at the UN high-level meeting, if we don't take action, if we don't do the things that we know that work, called best buys, it'll cost the world a $47 trillion loss in economic output over the next 20 years. So it's a bit of a no-brainer. We need to keep people healthy because it's the right and moral thing to do, but we also need to do it for our own self-interest in terms of economic growth and development.
Dr. John Seffrin, thanks so much for being with us today. And thank you for watching Newsmax Health.